Yes, today we are going to talk about diclofenac, and the drug class is it is a non-steroidal anti-inflammatory drug. Where most of us have used the diclofenac in our daily life. Let's see how is it given, how is it administered, which drugs does it interact with, and then what should you consider before taking diclofenac. So let's talk about the routes of administration. How do we administer? How do we give diclofenac? First is the oral route. In these we have the tablet form. Second, we have the rectal route. In this we are talking about the suppositories. Then third is the intramuscular route. Then the pharmacokinetics, what the body does to the drug. So when we give per mouth or orally, and we give a dose between 25 to 150, diclofenac is rapidly absorbed. Then the distribution, it binds on the plasma albumin, and the highest concentrations are found in the synovial fluid. The peak plasma concentration is achieved at 10 to 40 minutes. Then it is increased with foods which increase to empty the stomach, like metoclopramide. Then metabolism is done within the liver, and it undergoes significant fast pass metabolism with the 60% reaching the systemic circulation. Then excretion, 65% is excreted within urine and 35% is excreted within bile. Then we'll talk about the mechanism of action. Mechanism of action, like any other NSAIDs, it is not completely known, but the primary mechanism is responsible for anti-inflammatory, antipiretic, and analgesic action. So all what we are going to talk about is to tell us how does diclofenac cause an anti-inflammatory effect, how does it cause an antipyretic effect, and how does it cause an analgesic effect. And this is thought to be through the inhibition of prostaglandin synthesis. How does diclofenac inhibit prostaglandin synthesis? This is through inhibiting the COX-1 and the COX-2. That is cyclooxygenase 1 and cyclooxygenase 2. Remember, prostaglandins play a good role in inflammation and pain. So if they are blocked, it means there will be no increased swelling, which is the inflammation, and the pain will have reduced. That's how it causes the anti-inflammatory effect and the analgesic effect, then the antipyretic effect. Then lastly, it is also believed that it exhibits bacteriostatic activity by inhibiting the DNA synthesis and other antimicrobial activities against many organisms. Then indications. What are the uses of diclofenac? Last time we talked about paracetamol. We saw paracetamol works from mild to moderate pain. By this time around, diclofenac, we are talking about moderate to severe pain, mostly which is caused by inflammation and other musculoskeletal disorders. So musculoskeletal disorders we can talk about, like gout, which is the accumulation of uric acid within the joints, then and other conditions which are related to the musculoskeletal system. Then we give it in post-operative pain. Patients who are from operations, we can give diclofenac. Then we talk about migraine headaches or migraine headache. Then local local symptomatic relief of pain, and here we shall talk about the diclofenac gel. So when you see in the routes of administration, the topical route was skipped, so you have to add it there. Then in dysmenorrhea, which means painful menstruation. Then the dosage, how do we give it? In adults, we give from 75 milligrams to 100 milligrams daily in 2 to 3 divided doses, and the maximum is supposed to be 150. Then in children, if you have to give rectally, we shall give 0.3 to 2 milligrams per kg body weight, meaning you'll get the weight of the baby times 0.3 to 2 milligrams. Then diclofenac is supposed to be given as long as the pain is there, but it should not be given for a long period of time. Then when we are relieving local symptomatic pain, we shall use diclofenac gel, and here it is a thin layer is applied 3 to 4 times daily for 14 days. But in a condition like osteoarthritis, we shall give it, or we shall apply it for 28 days. Then let's see the side effects. What are the side effects of diclofenac? First is the gastric bleeding. This gastric bleeding is due to the blocking of COX-1. Remember, COX-1 is responsible for the stomach and the intestinal, and with the intestine. So if they are blocked, gastric bleeding can easily be caused. Then diarrhea, nausea and vomiting. Nausea, that is feeling like vomiting. Then we shall talk of gas and bloating, headache, dizziness, tinnitus. Tinnitus means ringing in the ear. Then gastric upset. Then we talk about hypersensitivity, that allergies. Then suppositories may cause rectal irritation. Then drug interactions. Diclofenac should not be given, or it should be given with caution with other NSAIDs because of the increased risks of side effects. Then with anticoagulants, there is increased risk of hemorrhage. Remember, diclofenac blocks COX-2, it blocks COX-1. COX-1, which is responsible of platelets. So these platelets, it means they will not be released to stop the bleeding. So if you give an anticoagulant with diclofenac, it means you're increasing the risk of hemorrhage. Then lastly, we shall talk about the quinolones, e.g., or like cipro or ciprofloxacin, where there are increased risks of convulsions. Then contraindications. Where should we give with caution, or where should we not give? People with previous or current peptic ulcer disease. This is brought up by the evidence that diclofenac blocks COX-1. Remember, in the side effects even we talked about gastric bleeding, and remember this patient already has peptic ulcers, so it means the risk of gastric bleeding will be high. Then asthmatic patients, or patients with high risk of hemorrhage, like patients on anticoagulants, people with kidney diseases. So people with kidney diseases, remember metabolism is within the liver, so meaning if the patient has a kidney disease and metabolism is supposed to take place within the liver, the toxicity and the metabolism will be distorted. Then third trimester pregnancy. Diclofenac is not recommended in third trimester pregnant mothers because of it has that effect of closing, premature closing of the ductus arteriosus. Then when you're giving diclofenac, what should you consider? Nursing considerations. Advising the patient to take the drug with food to minimize gastric irritation or gastric upset. Then in dysmenorrhea, when we are giving it in patients with dysmenorrhea, these patients should take that medicine or diclofenac when they feel the pain, as soon as they feel the pain, or as soon as possible after the onset of messes. But the prophylactic treatment has not been shown to be effective. So before you're expecting your messes and you take this diclofenac, it may not work. But when the onset or when your messes have started, you can take diclofenac, and when the pain has started. Then for patients who are applying it on the skin, they should apply it on an intact skin, not applying the gel within or on the wound. And an adequate gel should be applied to cover the entire region or to cover the entire area. Then advise the patient to take only the prescribed drug, because an increase, like how we said, not beyond 150, does not increase the effect of the drug, but it increases the chances of side effects. Then lastly, we are talking about the patient should report any adverse effects like weight loss, swelling of the fingers and the ankles. Thank you for listening. Please don't forget to subscribe.